Welcome all to the Milwaukee Summit on Community Justice Through Safe and Healthy Streets. My name is Katina Hooyer. I'm an assistant professor at the Medical College of Wisconsin and member of the Safe Healthy Streets project team. I'm a white female with brown hair, pronouns she, hers. Before we get started, just a few items that will guide you on how to interact with today's presentation. So today's summit is a live broadcast. While you as an audience will not be seen or heard through Zoom webinar, you can submit your questions in the question answer box at the bottom of the screen. You may also see a few polling questions throughout the presentations, and we hope you participate in those. You may also use the chat to engage with the presenters and other audience members. So I'm assuming that you're here because you, like myself, have felt that the design history of our streets have been dominated by the demands of large moving vehicles, often with little regard for the movement, health, and safety of the people that also use those streets. So this summit tells a story of a major change in design direction, with the acknowledgement that much work still needs to be done. The summit is the culmination of a 3-year initiative funded by the Advancing a Healthier Wisconsin Endowment. And the presentations you will hear emerge from a unique multi-sector partnership. This partnership is dedicated to supporting the implementation of Milwaukee's Complete Streets policy that was passed in 2018. And the partnership leaders are the Wisconsin Bike Fed, city planners from the Department of Public Works Multimodal Unit, researchers from the UW Milwaukee School of Urban Planning, and the Medical College of Wisconsin, and most importantly, the voices of the community as represented through the Safe Healthy Streets Core. So this unique partnership has provided the structure and guidance to advance 3 foundational tenets of Complete Streets philosophy. First, that all residents have the right to enjoy public spaces and feel safe using them, whether for transit or recreation, no matter what zip code they live in. Second, civic negligence and disinvestment of public spaces in those zip codes leads to disproportionate health outcomes for those residents, and these unjust biopsychosocial impacts get passed down to future generations. And third, to bring about useful change, the design of these spaces has to be human-centered, so actually involve residents in every step of the design process. Most of our partnership's achievements focus on systems change and collective action, of which you'll hear more about as the summit unfolds. But just to give you a taste, we've engaged neighborhood groups through Active Streets grants, a number of whom will be presenting their work at the summit. We've walked with community members along busy streets in their neighborhoods to discuss what might make them safer and more attractive. We've engaged children in the participatory design processes for safe routes to school. And we've engaged residents in Zeidler public dialogues on improved transit, of which you'll also have an opportunity to engage in today. Finally, there were 2 major research-related achievements of this project. The first is the development and use of the Milwaukee Complete Streets Performance Monitoring Framework. So this framework was used in the city's 2019 Complete Streets Health and Equity Report and forthcoming 2020 Complete Streets Annual Report. It will continue to inform the community-driven implementation of Complete Streets policy in the future. Through our community engagement strategies, and despite the challenges of COVID, we were able to collect and analyze over 1,000 responses in Milwaukee Safe and Healthy Streets surveys, which speaks volumes to our residents' concern and their desire for safe streets. Through this study, we gained baseline information about resident perceptions of corridor-specific street safety in the city of Milwaukee. So all the work I've touched upon would not have been possible without the many community voices, as well as the dedication of our core grant team of Carissa Gibbons and Michael Anderson of the Wisconsin Bike Fed, Mike Amston and his colleagues at the City of Milwaukee Department of Public Works, Dr. Bob Schneider and his students in urban planning at UW Milwaukee, and Dr. Jeff Morzinski, Melissa Denomi, and Dr. Marie Wolf at the Medical College of Wisconsin. So we are thrilled to have you here and to be part of this historic shift towards safe and healthy streets. Next, I'd like to introduce Jeff Polenske, Commissioner of Public Works and Chair of the Complete Streets Committee. Jeff was a critical leader in developing the city's Complete Streets policy in 2018 and has since been instrumental in implementing this policy on the ground throughout Milwaukee.
All right, thank you, Katinka, and thank you and welcome all who are in attendance today for the 2021 Community Justice Through Safe and Healthy Streets Summit. Again, I'm Jeff Polenske. I'm the Commissioner of Public Works. I'm a white male with very little hair, and my pronouns are he, him, his. I would also like to acknowledge and thank Katinka, but also Melissa Denomi and the Medical College of Wisconsin team and the Safe and Healthy Streets grant, the Safe and Healthy Streets grantor, Carissa Gibbons, Wisconsin Bike Fed for organizing the summit and being instrumental throughout the Safe and Healthy Streets grant. Dr. Bob Schneider at UWM for helping to lead the data discussions and community survey as a part of the grant. Kate Nelson, Willie Cardidis, Joyce Tang Boyland, Kara Hunt for the dedication to safer streets and serving as community voices throughout the Safe and Healthy Streets grant, and all of the presenters during this two-day event, as well as our city and agency staff, colleagues from around the country, willing to share their expertise and experiences, and so many community partners and leaders who are passionate about making Milwaukee a better place to live. We're really at a pivotal time here in the city, and the question probably should be an easy question to answer, but why are safe and healthy streets important? And really over the next 2 days, we're excited to hear from the experiences of many of our presenters on how we can become a better community. We adopted our Complete Streets policy in 2018, and we've had experiences over the last couple of years with reckless driving in our community. It really is one of the more pressing issues that we have throughout our community, and has probably some of the greatest impact on the quality of life in Milwaukee. The pandemic has highlighted the importance of being able to safely and comfortably walk and bike around our community. We've obviously tried to do more things to get people outside and active during this time. And really, Milwaukeeans are demanding that we reimagine how our streets are used and what they look like. As I said, we've done a few things with active streets programs, active streets for business programs, artistic crosswalk intersections and sidewalks, and just simply safer places to walk, bike, and roll. All of this is happening as the fight for social and racial justice has again been brought to light so many historic and present day inequities that impact Black and Brown Milwaukeeans on a daily basis, many of which are pertinent to how people get around. Our interstate system to this day has created divides in our social fabric, income levels, and access to opportunities. Many of our biggest, fastest, and most dangerous streets, arterial streets, are in the north side or on a near south side neighborhoods. People of color in low-income communities lack access to parks, trails, and open space, denying them the physical and mental health benefits of getting outside and being active. Streets that are safe and healthy and allow for expanded mobility options can help address these inequities and create a better city. Over the next 2 days, you'll hear what we're doing as a city to address these challenges and inequities. And we also look forward, as I said, to learning from our presenters on what we can be doing better. We're trying to engage residents, business owners, people who travel throughout our city in a meaningful way, and use their lived experiences to help us better design our streets. We're collecting data that reflects how everyday people get around or want to get around our city. And we're redesigning streets to focus on safety and comfort and enjoyment. And sometimes this comes at the expense of quick and uninterrupted automobile travel. But we are still just beginning, and have a long way to go to ensure we're implementing our complete streets policy in all of our work. And most importantly, we need to continue to do more to ensure our work is done in an equitable way so that our neighborhoods that have experienced disinvestment realize the true benefits of safe and healthy streets.